The time when I was there, I got in during December, and that's when the crayfish season starts. So we put the pots out along the cliffs in Streaky Bay. But a great experience to be out on the water early in the morning. Great to wake up and start the new day. We'd be back at the house, we'd have breakfast and get ready to go to the hospital. The hospital's a small 20-bed hospital. 10 beds are palliative and 10 beds are acute. In the hospital, Dr. Oswald also does outpatients, where he does all his minor surgery instead of doing them in the GP clinic. I got to observe skin cancers being cut out, punch biopsies, the taking of blood, and various other examinations in outpatients.
I was particularly interested in women's and children's health, so I was involved in plotting of growth charts and doing the surveys in terms of the welfare of the maternal and child health welfare. Because Pete's an anaesthetist and you get to sit in on a lot of surgery, you get to realise that country doctors, there's a whole range of specialties. So, for example, Ben, the general surgeon, that comes in for operations. Fiona, another doctor, Peter's wife, who's an obstetrician. So we've been in with a few childbirths with Fiona, which is really good. In the Indigenous population, as right around Australia, there was a lot of diabetes and other chronic diseases, so there was a lot of management of those, hypertension and those sort of things. There was also a lot of skin infections and boils and those sort of, and just minor cuts and bruises, as well as broken arms and legs due to trauma. And then because the mine in town is very close and is a larger employer in town, there were a lot of accidents out there as well that also were brought into the clinics. So today, for example, Pete was on call, so the on-call doctor always takes emergencies. So about lunchtime we got a call from a young girl's parents, 12 years old, fell off a horse, so she knocked her head pretty bad. And just as we were about to leave, we got another emergency call from an old lady with a suspected heart attack, so had to get her in and took a couple of hours to deal with that as well. So yeah, definitely emergencies pop up out in the country and you get to see them, yeah, so it's good.
I'm at a stage where I'm really deciding where I want to go in life and what sort of medicine I want to practice and what professional path I want to take. And I think being involved in the John Flynn scheme really gives you a view to helping make those decisions and having something really solid to make those decisions, really firm foundation to decide, well, this is a career path that I would like to take, or this is a lifestyle that I would like to live.
My ultimate aim over the course of the time was to become accepted and integrated to some extent within the community, and I think I achieved that. If you talk to talk and be interested in your patients and their stories and all of that sort of stuff, there were patients that asked to come back and see me, and you'd have to say, oh no, I can't, I won't be here, I don't live here, and that you get that sort of really positive feedback that makes you sort of think, oh well, maybe I am going to be good at my job. And
when you're interested in rural health, you have to recognise how different it is from city medical practice or practicing your medicine in a hospital. So as rural medicine is very demanding, and you have to be sort of aware of these differences and commitments. But in a sense, I feel rural medicine has its rewards as well, and you have to be aware of that as well in order to want to practice in rural Australia. You know, being integrated with the community, knowing the person from throughout their lifetime, so being able to provide better care by knowing the person well, just having a sense of fulfilment that you wouldn't get seeing a patient walk through in a city bulk billing practice, and being a leader in a community, because in rural Australia a doctor is often a leader, and I think that's a very important point when it comes to practicing rural.